So Quantum RF is a minimally invasive device that combines RF, and when I say RF, think thermal, think heat energy, in a way to tunnel under your skin to get right into that subdermal fat, to melt fat and tighten skin. So if you think about what Morpheus does, Morpheus is that same RF technology on the outside of the skin. So you're trying to apply that energy from the outside in to stimulate your body to basically regenerate itself. The beauty about Quantum is that we get to go underneath the skin to not only get rid of that excess fat, to shrink those fat cells, but also to tighten the skin and do that same rejuvenation process at a much greater level. Because we're below the skin and below the area where those pigment cells are, your melanocytes, we can also use a much greater degree of heat, much greater degree of thermal energy to even give you a bigger bang in the areas that we're treating. So Quantum RF and Morpheus are kind of like first cousins. Morpheus is like the little pesky cousin that's able to do a really good job at most things, but has to wait on the outside. Quantum RF is the big cousin that comes in and actually does the big work. Quantum RF and Morpheus use the same kind of energy, which is radiofrequency energy or thermal energy. The difference with Quantum is that it's actually able to tunnel under the skin and apply a greater amount, a greater degree of RF energy to the areas that we're treating. Your ability to get improvement in the way your skin looks and the way your skin feels, the turgor of your skin, it's a lot more enhanced with the Quantum RF technology. What limits us on Morpheus for some patients is the fact that you have to titrate your heat and your depth for patients that are predisposed to having hyperpigmentation. Especially patients that have darker skin tone like myself, this is always a concern when you're treating a patient with Morpheus. With Quantum, your concerns about pH aren't zero, but they're also much less because we are under the area where those melanocytes, those pigment cells live. Because we're also using a very focal amount of energy, the energy that gets dispersed is within a very concentrated area. So we can target very specific areas of fat and skin laxity with the Morpheus, with the Quantum, in a way that we aren't able to do with Morpheus. So we tell all of our patients that you're gonna get 25 and 25. What does that mean? That in 25 weeks, which is pretty much similar to the timeline that you would have for liposuction, you're gonna get a 25% reduction in the fat content, as well as a 25% improvement in the skin tightness and skin texture. We have patients that experience some of these changes as soon as 4 to 6 weeks after. And it's a gradual process. Everyone is different, but we tell everyone 25 by 25. So most patients come to me for one of three reasons. They don't want to have surgery, either because they don't have that kind of downtime, they don't necessarily want as involved or an extensive of a procedure. Two, they're the I don't want anesthesia patients, who just want to avoid general anesthesia. And then we have patients that have laxity that is not severe enough to require surgery, but also it's concerning enough that they want to do something about it. So those are the main patient groups that we get. And Quantum RF is ideal for all of them because you don't have to have general anesthesia. The devices that we use are actually pretty tiny. This is actually the Quantum RF that we use for smaller areas like the face, under the neck, even arms. And as you can see, it's ridiculously tiny. So you also avoid, in addition to having just a surgery, you also avoid having a large scar. We also have a proprietary technique of making our patients super comfortable called Sleeping Beauty, which is something that we add in for all of our Quantum RF patients. It's a way of getting you comfortable that doesn't require general anesthesia, doesn't even require an IV. Basically what we do is connect you to a really safe amount of laughing gas or nitrous oxide that allows you to kind of coast through your entire procedure. It doesn't require any downtime. Patients can actually drive themselves home after nitrous, so it's very safe. And the other group of patients, like I said, are the patients that have maybe lost some weight, maybe patients that have now are coming off of tirzepatide or semaglutide and have a little bit of laxity, and they're really concerned about their overall contour or a contour of maybe their arms or maybe their under neck area. And for them, Quantum's a great fit. So Quantum RF is minimally invasive. What does that mean? It's not major surgery where you don't require a large incision. We actually make very tiny incisions about the size of a pencil eraser that allows us to use the Quantum device in the area that we're treating. Prior to doing any of that, however, all of our patients are given topical anesthesia. If our patient chooses, they can also have an oral sedative just to kind of take the edge off before we get started. Before we even get to the point of doing the procedure, we also inject more local anesthesia so they're completely numb. During the injection process is when Sleeping Beauty begins. So when patients come into the procedure area, they're connected to a small nasal hood. They don't have to do anything. We control all of it, and they passively get a little bit more sleepy, a little bit more floaty, a little less concerned about what's going on. We keep the Sleeping Beauty treatment going on until injection is done, and for patients that kind of want to be awake during the procedure, it takes about 30 to 45 minutes. They're completely numb, completely comfortable, the procedure's done, and they go home. Because we put local anesthesia under the skin, they're comfortable probably for 2 or 3 hours after they leave. So I send all of my patients home with pain medication. Almost none of them need it.